You are watching Rise at 9. I'm Nupur Talwar Suri. Help has been arriving from all corners of the world to India as it battles the second wave of the pandemic. One such organization which has been at the forefront of raising funds for people in India is the American India Foundation. It gives me great pleasure right now to introduce the CEO, Mr. Nishant Pandey, who's joining me live this morning. Good morning, Mr. Pandey. Thank you very much for being with us here on Republic TV.
Good morning, Nupur. Thank you so much for inviting me.
Right now, Mr. Pandey, the AIF, of course, has raised over $25 million, which is huge by any standards. Now, how did you come about that? And I'm sure it was extremely difficult to raise that money in that short period of time. Tell us more.
Yeah, Nupur. Before I answer your question, for your viewers who may not be aware of what American India Foundation is, we were set up 20 years back in the aftermath of the Gujarat earthquake, at the initiative of President Clinton, following a suggestion by the then Prime Minister, late Shri Atal Bihari Vajpayee ji. Our mission is to serve underprivileged women, children, and youth in India, and do it in a way that it builds a lasting bridge between the two largest democracies of the world, US and India. Over the last 20 years, we have invested more than $150 million in health, education, and livelihoods across India. And we have responded to all major humanitarian disasters in India in the last 20 years. So COVID, of course, was no different. When COVID hit India, we launched our COVID relief last year, and we served more than 500,000 people directly across 18 states of India through ration kits, hygiene kits, and we worked with state governments to provide ventilators and PPE kits and other life-saving equipments and medical supplies. Of course, at that time, we did not know that the second wave is going to hit India, and it's going to be so ferocious. So we were kind of moving slowly into more kind of medium to long-term programming on the ground. And that's when we realized that late February, early March, cases started to rise in India. And we kind of grouped together again to figure out what it means for us and what we can do to address this situation. So we launched our COVID relief work phase 2. Of course, last year we did not call it phase 1 because we did not know that there will be a phase 2. About 3.5-4 weeks back. And that's when we realized that it's getting much bigger. It's getting much bigger in terms of scale and complexity. So we launched our fundraising appeal on 24th of April. And so it's been now roughly about 20 days. And we are very humbled by the outpouring of support from everyone, literally, in the US, members of the Indian American community, other diasporas, and generally the American public, corporates, high net worth individuals, and literally everyone. We have managed to secure commitments of about $25 million, of which we have already deployed $20 million in our COVID relief.
Right. Now, Mr. Pandey, as you were pointing out, the AIF, of course, was founded at the behest of Bill Clinton, who was the US president at that time. And, Hillary Clinton has had a lot to do with this round of fundraising. In fact, she's tweeted about it constantly. Now, tell us a bit more about that aspect. Of course, the Clintons have been extremely involved in this organization.
We are very thankful for all the support that we have got from all corners of the society and economy and politics over the last 20 years. Of course, Clinton's played a very instrumental role in creation of AIF 20 years back. And AIF has grown into a much larger organization with 12 chapters across the country, in the US, with support from many corporates who operate in the US-India corridor, both American companies and the US companies. And really, our vision is to create a lasting bridge, a lasting partnership between US and India Of course, there is a very, very strong strategic partnership between our governments and businesses. But we know from the global experience historically that any partnership between two countries becomes lasting only when there is a strong people-to-people connection. And that's what we focus on as an organization. And of course, we take the philanthropic route to be able to achieve that. For example, we have been running a fellowship program for the last 20 years where we get young, bright professionals from the US to go and serve in social enterprises and NGOs in India for a period of 12 months. And more than 500 fellows have graduated from this program. This long-term programming is what gives us the relationships with the state governments, very strong relationships with the communities across India, across all states of India. For example, in the last 2-3 weeks, as part of our COVID relief work, we are providing almost 5,500 oxygen concentrators to about 10 states of India. We are setting up oxygen plants across 13 states of India. All of this in collaboration with the various state governments. Just last night, a shipment that we sent from here with 30,000 ventilators, more than 30,000 ventilators, landed in Delhi, which is going to be distributed to 5 state governments across India. So this solid relationship that we have with the state governments in India is because of the long-term work that we do on health, education, and livelihoods with these governments.
Right, Mr. Pandey, as you said, obviously it's extremely important to have ground connect and to be able to work with state governments, because that's where, a lot of NGOs find it troublesome, because, it's very important to know where the need is most. Now, I believe you've also been in touch with the principal scientific advisor of the government of India, to be able to focus perhaps more on, the neediest people in the neediest areas of the country, specifically, perhaps rural communities, which are in the second wave, unfortunately, facing the brunt of it.
Yeah, the only way to achieve scale and sustainability in whatever you do in a country like India is to work with the government. And of course, when we talk about health, education, and livelihoods, it's the state governments which are very, very responsible. Having said that, it's the central government that sets the agenda, that provides the steer and the policy direction. So we have been engaging with the central government for all these 20 years. And when we talk about COVID and what can be done to address this unprecedented challenge that India is facing, it's very important to look at innovations and science-backed solutions. And so we have been engaging with the Office of the Principal Scientific Advisor. We are installing 2,600 beds in existing government hospitals. And the Office of the Principal Scientific Advisor has come up with a solution, with an innovation called portable hospitals. These are not new hospitals. These are extensions of existing hospitals, anywhere between 20 to 100 beds, which are fully equipped. So a 100-bed unit comes with 5 ventilators and 10 oxygen concentrators. And these are not temporary hospitals. These assets exist for 25 years. So we are investing in long-term infrastructure development, health infrastructure development of existing government hospitals across the country. And that's where the partnership with the Office of the Principal Scientific Advisor has been immensely useful.
Now, Mr. Pandey, you mentioned the fact that, you are investing in long-term health infrastructure. Now, that, of course, has been a cause of concern in India because, large as our country is and the number of people we have, it is very, very essential that we take this, the COVID pandemic as a clarion call, perhaps, for more health infrastructure. So in the long term, is that what perhaps part of your focus is going to be?
Absolutely. I think this is a reminder that we need to really take investment in health infrastructure very, very seriously. There are many ways in which the second wave in India is different from the first wave. But second wave has kind of really starkly exposed the fragility of health infrastructure. I mean, if you take oxygen, it's not oxygen per se which is in short supply. It's the distribution infrastructure. It's the network through which you move oxygen from a plant to a city, and from a city to a hospital, and from a hospital to patient bed. And that's what I think it's a big reminder that we need to really invest as a country. But also, the reason why there is such an outpouring of support from places like the US, for example, is because I think people know that the pandemic is not over until it is over in India. With the scale and the complexity of India, unless we manage to control it in India, it will be very difficult to control it globally. And therefore, I think India needs global support, and the global community has the responsibility to support India, not just in dealing with the here and now, but also looking at some of the more medium to long-term investments in health infrastructure. I think the government has done quite a good job in terms of, programs like Ayushman Bharat, which provide coverage, but that looks at the demand side of health solutions. We need to also look at the supply side of the solutions, the quality of healthcare that is available through public hospitals in smaller cities and villages. I mean, if you look at, again, the second wave, the first wave was predominantly concentrated in large urban centers. But in the second wave, we have seen large number of cases coming from smaller cities and villages. These are areas which also happen to have the weakest public health infrastructure. And we know that most poor people rely on government hospitals and primary health care centers for their treatment and care. And I think we need to look at the supply side and how we can strengthen the infrastructure in the long run as far as health delivery is concerned.
Now, Mr. Pandey, I'd like to bring your attention to, the education sector. There are various studies and there's a lot of research that has gone in after the pandemic hit the world. Now, one of the communities, of course, which will be hard hit, at least in India and, poorer countries across the world, is the education sector for younger, for children. Now, I know that the American India Foundation focuses a lot on women. It focuses a lot on children. Now, is there perhaps something that you are planning to do for education sector in India specifically, because even though we've seen schooling online in cities across the country, but in villages it remains a real challenge.
Yeah, thank you for raising it, because I think right now everyone is focused on what is required right now to save lives, but I think soon we will realize that what India is going through is going to have very serious long-term implications, whether it's on children's education or health of adolescent girls or jobs and employability of our youth, many such issues. So thank you for raising this issue, because it's not being talked about as much as it should be. So if you look at children's education, there are two issues that have, again, been underlined by COVID very, very starkly. The first one is that, this is probably the first time that schools have been closed for so long. And that is leading to a deficit in terms of learning for children, especially younger children. We know from global evidence and evidence in India that once a child at a young age loses learning, it's very difficult to recover from it at later stages in life. So for the last 12 months, millions of children are actually missing out on learning and education. The second thing it has very starkly exposed is the digital divide. While many kids in private schools in big cities manage to move to digital mediums for online learning and things like that, the reality is that a large part of the country does not have access to technology and connectivity that will allow children and their schools to transition to more remote learning. And I think that is something that we must, again, invest in. There are about 220 million children who go to public schools, government schools every day. And, the data is that only about 25% of government schools have computers, let alone how those computers are used or how well they are used, right? So in that kind of context, if you have schools closed and children are sitting at home and there are very few avenues for them to continue to learn, I think it becomes a very, very challenging long-term issue for country. So what we have been doing is we have been using innovative technologies and some process innovations to make sure that the children that we work with continue to learn, using WhatsApp, using community volunteers, and lots of other innovative methods. We also partnered with Byju's, which is perhaps the world's largest edtech firm by market cap, to provide online content to 10,000 government schools across the country. And that all that work was going on until this second wave hit India. So we are hoping that we will soon recover from the immediate impact of the COVID second wave, and we can resume some of the work that we were doing in terms of the more long-term impact of COVID and addressing some of those long-term challenges.
Right, Mr. Pandey, we really appreciate you taking out the time and speaking to us on Republic TV. And of course, we can't thank people from across the world, including so many Americans who have donated for this cause, who are helping us come out of this second wave. Thank you.
Thank you so much. Thank you.